Hey Lady Peeps, as women we hear a lot today from media and influencers about the best ways to keep fit and healthy through exercise, diet, cleanses and how to look good on the outside. We're bombarded with information on how to be the healthiest, fittest, most fabulous version of ourselves. But we rarely hear about sexual health, right? Even though most people on the planet will have sex at one time or another, or all of the time. And our sexual health is very important. But sometimes, well, it's hard to talk about it, even though taking care of our sexual health is just as important as taking care of every other aspect of our bodies. And there should be no shame or embarrassment in it. Why does it matter if we talk about it? Because since 2013, the rates of some sexually transmitted infections, including syphilis in Australia, have been rising at an alarming rate. Syphilis in people who are pregnant or ever want to become pregnant is particularly concerning because a pregnant person with untreated syphilis can pass it on to their unborn baby and cause miscarriage, stillbirth, or physical and intellectual disabilities. So, how do you know if you have syphilis? Like many STIs, there may be some symptoms or there may be no symptoms at all. If the infection is not treated, any signs and symptoms will go away, but the infection remains in the body and can cause longer-term health issues. It can also be passed on to sexual partners or an unborn baby in pregnancy. The only way to be 100% sure is to visit your doctor or sexual health clinic and ask for a test. A simple blood test is all that's needed to diagnose syphilis. There's no need to feel uncomfortable, awkward or embarrassed. It's literally their job and completely confidential. And don't listen to stereotypes. Anyone who's ever had unprotected oral, vaginal or anal sex can be at risk for syphilis, whether you've had one sexual partner or many. The good news is that if detected early, syphilis is treatable with antibiotics, and if you're pregnant, it will help to treat your baby. You also need to inform your current and past sexual partners so they can get tested and treated too, and not pass it back to you or other sexual partners. If you don't want to tell them in person, there are websites that can send them a notification via text message or email anonymously. So, whether you're in a long-term relationship, single, or having casual sex, being an empowered woman today means taking care of your whole health, including being safe, informed, and proactive about your sexual health. Make sexual health checks a regular part of your healthcare routine, because even if you've been treated for an STI like syphilis once, doesn't mean you can't catch it again. We need to unite as a sisterhood. Don't let anyone judge you or make you feel ashamed. Take control of your sexual health today and encourage your friends to do the same. Ask your doctor, nurse or midwife about syphilis. We got this.